Bones, joints, and muscles all work together to facilitate movements. The bones provide stability to the body, they support our skin, give our body shape, and protect and support our organs to make it possible for us to move. The bones serve as a point of attachment for muscles. The bone matrix also acts as a reservoir for minerals like calcium and phosphorus. Bones have a couple of different characteristics. Long bones like the femur or the ulna provide leverage. Short bones like the tarsals or the carpals provide stability, support, and allow for some motion. Flat bones like the sternum or the cranial bones are points of attachment for muscles and protect your internal organs. Now, irregular bones like the vertebrae or the facial bones also protect your internal organs. The sesamoid bones, like the patella, protect tendons from compressive forces. Each of these bones are comprised of 4 cells that are crucial for its function, like the osteocytes, the osteogenic cells, the osteoclasts, and the osteoblasts. Without bones, our body wouldn't be supported, so it would be impossible to move. Joints allow motion. Different bones are connected by joints, and the skeletal muscles are attached to these bones and are arranged in opposing groups around those joints. There are many types of joints that can be subdivided by their structure and their function. Plain joints allow for limited gliding movements between bones, like the intertarsal joints. Hinge joints, like the elbow, allow bones to move along one axis, like inflection or extension. Pivot joints, like the cervical vertebrae, allow rotation around an axis, like in side-to-side movements. Colloid joints, like in the radiocarpal joint of the wrist, allows for movement in 2 planes. Saddle joints, like in the carpometacarpal joints of the thumb, provide stability to the bones. Ball and socket joints, like in the hip or the shoulder, allow for flexion, extension, abduction, adduction, and rotation. Each movement in a synovial joint results from the contraction or the relaxation of the muscles that are attached to the bones on either side of the articulation. Skeletal muscles keep bones in place and joints stable. Skeletal muscles also protect internal organs by acting as an external barrier or shield to external trauma and by supporting the weight of the organs. Muscle contraction and relaxation occurs in 4 steps: excitation, contraction, coupling, contraction, and relaxation. In excitation, nerve signals are sent from the central nervous system to the synaptic knob of the neuron, which releases acetylcholine and causes that electrical excitation to spread across the muscle fiber and down the T-tubules. In excitation, contraction, coupling, that electrical signal goes to the sarcoplasmic reticulum, where calcium is stored, and then releases it into the sarcoplasma. Calcium then binds to troponin, and then the troponin-tropomyosin complex changes shape and exposes the active sites on the actin. In contraction, the myosin heads are activated by ATP, which swing into a cocked position that bind to the actin active sites, then flex and pull on the actin filament. This is called a power stroke. A recovery stroke recocks the head and allows this process to repeat. Once more ATP is available and myosin releases more actin. In relaxation, the nerve stimulation and acetylcholine release stops. So the calcium is pumped back into the sarcoplasmic reticulum by active transport. Then the tropomyosin shifts and blocks the active sites. So therefore, the myosin active links cannot form. Bones, joints, and skeletal muscles are all necessary for movement. The bones provide stability to the body, give it shape, while also protecting and supporting organs. The joints connect the bones and attach the muscles to the bones. Then the skeletal muscles keep the bones in place and the joints stable.